In this section, Dr. Barry Grayson will explain some of the treatment planning thoughts in setting up the LeFort 1 midface osteotomy. This patient has classic midface hypoplasia associated with unilateral cleft lip and palate. Of course, in LeFort 1, his non-cleft segment will have to be advanced, as we see here. But usually, because of the increased deficiency on the cleft side, the segment must come much further forward. Often the canine will be brought next to the central incisor, as often the lateral incisor is missing. This will bring the bone under the base of the piriform aperture relatively further forward on the cleft side, giving better balance under the base of the nose, as can be seen here. While a two-piece LeFort 1 would seem to have advantages in increasing the flexibility of the movement between the two sides, decreasing the amount of pre-surgical orthodontics required, it has the disadvantage of requiring a bone graft done at the same time as a LeFort 1. Given that the sinus is open on the cleft side, this leads to an increased infection rate when a two-piece LeFort 1 is done in conjunction with a bone graft. Of course, the skeletal changes reflect themselves in the soft tissue, with the nasal tip structures being particularly brought out. Following bone grafting, the LeFort 1 piece is a single piece, as is illustrated here. In planning this sort of LeFort 1, one must think of the LeFort 1 segment as having a rotation about the long axis of the body. Here we can see the cleft side is being rotated out more anteriorly than the non-cleft side. Of the lateral incisor and the relative rotation of the non-cleft side toward the cleft has brought the interincisal point too far over to the cleft side. This must be rotated, in this case towards the patient's right, to match up the interincisal points. Notice also that the bone under the base of the nose is brought relatively further forward on the cleft side than the non-cleft side as a result of this rotational movement. With unilateral clefts, will frequently have a vertical deficiency on the cleft side as well, as illustrated in this particular case. In this kind of LeFort 1, not only will the two segments come forward, but the cleft side will rotate vertically down. On the non-cleft side, a simple forward movement is all that is required. This has been discussed previously in the initial segment in this unit. On the cleft side, however, it will be necessary to rotate down the cleft segment. This is facilitated with an angulated osteotomy that is higher in the back than the front. This allows the segment to rotate down and still maintain bone-to-bone contact. Again, the bone under the base of the nose is brought relatively further forward in this kind of movement, as well as down.